It's 8:19, Big 550 KTRS. We're going to check in with, normally we check in with Dr. Jeffrey Lowell, but today, Dr. Bradley Freeman, professor of surgery at Washington University Medical School. Good morning, Dr. Bradley Freeman.
Hey, good morning, McGraw. Good morning, Kelly.
Good morning.
We keep hearing a lot about Listeria. What is it, and how do you get it? It doesn't sound very good.
It does not sound very good, and it's not very good. And this recent outbreak concerns a creamery or a dairy Blue Barrel dairy who had a recent recall of virtually all their products due to an outbreak of Listeria and contamination of their production process. And so obviously it's a huge financial hit for the company, but certainly they're behaving very responsibly. But Listeria is a bacteria or a germ that's common in the environment, so it's found frequently in animals and a lot of water sources, and particularly in animals, it's very common to the digestive tract. And it turns out that Listeria is the third most common cause of food poisoning. And so you can see if something is in an animal and its digestive tract, you can see how it could contaminate meat products and make it to a human if the meat was not handled correctly, meaning if it wasn't cooked to the appropriate internal temperature and that sort of thing. And by virtue of the fact that it is in the water supply, it's commonly also can cause food poisoning by, say, being on inadequately washed vegetables and fruits and that sort of thing. And so what happened in this current outbreak, and we hear about these kind of outbreaks 2 to 3 times a year, is obviously there was some type of contamination in the product supply and manufacturing these products. And the people that are most at risk typically are people at the extremes of age, meaning very old people or very young people, and also classically in pregnant women. And it manifests itself in somewhat flu-like symptoms and fever and joint aches and a lot of diarrhea and that sort of thing. But nonetheless, several thousand people a year are reported as being infected with Listeria, and it still causes death in a minority of those. So it potentially is a very serious infection, but by and large, just common sense food handling protects most people from it.
Once you get it, is there some type of medicine you can take to sort of lessen the effects?
Yes, it does respond to common antibiotics. So if it's detected in a timely fashion, it is certainly imminently treatable.
Gives you a good reason to make sure your meat is cooked at the right temperature and you wash your fruits and vegetables.
Yeah, you can't be cavalier about that. I think you do have to be fastidious about that.
Yeah. Doctor, you're a trauma surgeon among your many different hats you wear, and this story is kind of interesting. They're now starting to study what the consequences are of firearm violence in emergency rooms.
Yeah, well, this is a study that came out of University of Washington, who has done a lot of public health research with respect to all types of trauma-related injuries, whether it be motor vehicle crashes or industrial accidents or accidents as a result of, say, firearm injuries. And they looked at what, if you will, was the natural history of patients who were admitted to the hospital with an injury secondary to a firearm. And I've often thought about this when I take care of these patients in an urban environment. And it turns out, if you look at a patient that, if you follow a patient that has been admitted to the hospital for a firearm-related injury, they have a 20-fold increased risk, number one, of a subsequent hospitalization for a firearm-related injury. Number two, they have about a 4-fold increased risk of death down the road due to a firearm-related injury. And number three, they have about a 3-fold increased risk of being convicted of a violent crime. And so, that really points out the public health burden of this problem. And I would say, by analogy, if we said, if you were admitted to the hospital with, say, McGraw disease, and we found out that placed you at a 20-fold increased risk of subsequent admission of McGraw disease and death, et cetera, we would jump on it with both feet. And so I think that this is a huge public health problem in our society, and I don't say this glibly because obviously there's a lot that goes into these problems. It's access to firearms, it's poverty, it's the crime rate, etc. But it's something I think as a society we have to come together on and work for productive solutions.
Let's just so we get these numbers right. You're saying that if you are admitted to a hospital, emergency room, or whatever, and over a gun-related injury, you have a 21% fold increase in another hospitalization related to a firearm injury.
That's right, 20-fold increase, 20 times the normal population. So pretty phenomenal, actually.
Yeah, and you're saying that if you were admitted for the common cold and you had a 21% chance of subsequently being hospitalized for the common cold in the future, there would be a massive There would be a massive effort to somehow solve that problem.
And I say the other piece of this is that these are very expensive injuries to deal with. They're very resource intensive. They cause a lot of disability. Frequently, the patients are uninsured or underinsured. So it's a public health. It's a financial drain. So I mean, there is a lot that goes into that number. But yeah, a 20-fold increased risk of subsequent hospitalization due to firearm injury. So it's kind of mind blowing.
Yeah, really interesting. And while we still have you, Doctor, homeopathic medicine now being looked at by the government.
Yeah, well, so a lot of people and many of our listeners pursue healthcare outside, say, the traditional boundaries of medicine, and I'm not here to criticize that, and I think there is a role for it. I think the problem becomes that it is totally unregulated for some of these, and specifically the branch of complementary medicine called homeopathic medicine. There's a lot of concoctions out there on the market for all manner of ailments. And so what has happened in the last 2 days in D.C. is that the Food and Drug Administration has received testimony both for and against greater oversight of these products, meaning if nothing else, just saying what the product actually contains and maybe some statement about its potential effectiveness. And so virtually all these things are unstudied, and I think the take-home message is that the consumer should be aware as to both the cost of these products and their potential effectiveness.
Really interesting stuff. Dr. Bradley Freeman, professor of surgery at Washington University Medical School. Doc, thanks for checking in. Good to hear your voice, and we'll talk to you down the road.
Have a great week.
You got it. Dr. Bradley Freeman with us, and him and Dr. Jeffrey Lowell every Wednesday here on the Big 550.